So welcome to this episode of Movement Medicine Podcast. Thank you to everyone that's tuned in so far. Please continue to share with your friends, your family and your colleagues. Please also make any comments to the videos, any questions that you might have, and we'll try and address those in future videos. Thank you to our partners. So it's the Fit India Movement, the Back to Fitness Clinic, which is the clinic that Rajat runs, the La Ultra The High, which is the race that Rajat puts together in Ladakh, and also the Moving Mountains Within Film, which is the film about the 10th edition of La Ultra The High. So I'll hand over to Rajat, who will introduce today's guest.
Thank you, Darren, and thank you all for watching Movement Medicine Podcast. And today we have a special guest, Dr. Gurinder Bedi, leading orthopedician, leading orthopedic sports surgeon of Delhi. So welcome on board.
Hi, Rajat, and thank you so much for Darren, Rajat. Thank you so much for having me. Always fun being with you guys.
Thank you. Can you just take us through, please, your academic and professional background, please, to start with?
Okay, so Rajat, I work as a director of orthopedics in Fortis Hospital, Vasant Kunj presently. So I'm on the wrong side of 50. I've been doing this job for about 30 years now. So I did all my graduation, my post-graduation in Delhi, then went off to UK, trained a bit, got my fellowship at the Royal College and the Intercollegiate FRCS Orth, practiced as a consultant, came back. I've been back now for about a good 10, 12 years and all. So I work with a practice which has got sports medicine, arthroplasty, trauma, mixed in kind of stuff.
Okay, fantastic. Thank you for the introduction. So I just wonder whether you could tell us about your personal sort of fitness and exercise journey. Have you always been active as an individual?
Okay. So, Darren, I'm not the sort of, the die-hard kind of a guy who's got, bulging muscles and everything, but I think I would like to call myself fairly fit. So fitness for me is, something which goes into your mind and your body both. So you can't be sort of, only mind or only body. So my, I have a little sort of almost like a passion for what I do in my work. And I think that's what occupies so much of my mind. But there is no doubt that I've, more and more later on I'm getting in life, I realize that till I get my body to keep up, the passion can actually take a backseat and will not do much at all. So even to live up to my passion, if I don't get my body keyed up today, I'm feeling that I'm losing my efficiency and everything I do at work. So my trip with fitness has been somewhat erratic. In fact, in the beginning years, I used to do a little bit of running. I used to do a little bit of exercise and everything, but never did anything very consistently. And actually, I can tell you, I'm regretting it now. I should have started long time back. So nonetheless, not too late still. So what I'm doing now is, you see, one thing I've noticed once I started touching 50 and everything, my strength wasn't actually as much as it used to be. So I could get through, 3 or 4 bilateral knee replacements at one stage and, not even break into a sweat. Lately, I realized, I'm not sort of, as good as I needed to be. In fact, I would never go and sit in the chair. But now I think, between cases, I actually like to look for a seat or something. And that's where I realized I need to push myself harder. So what I do now is I do 3 days of yoga every day. And 3 days I'm out running. I'm actually been very influenced. Actually, I'm sure you both know about it. Rajat started a program called C11, which was the couch to the 11 kilometer kind of a thing. I have to say it's still, running that half marathon is my bucket list. But I'm actually, much better because, it was absolutely wonderful for somebody like me. Rajat would send out a message every day in the morning. I would see that message, walk that much, run that much, walk, run that much, few exercises, squeezing the lemon, doing squats and everything. That's what actually got me going. It's been just over 1.5 years. And I've been trying to do up with that running and everything. Winter was a bit of a bummer because my work starts fairly early. But that's what I've been doing. And I'm actually much better. Mind, body, both putting much better.
Brilliant, sir. Sir, could you take us through, various places that you've been around the world and your practice and how it's changed courtesy your own fitness? Advice to someone based on your own running or based on your own strength training that you've done. Okay. And how has it impacted the practice itself?
Okay. So one thing I think I'm a bit of an outdoor kind of a person. So I have never been very, very keen to do the gym-based workout. That's where people actually, strength training is very, very important, and I can understand the importance of doing resisted and weight training and exercise and all. But I've really been much more of an outdoor kind of a guy. So I've actually done sort of some bits and pieces in lots and lots of places. Presently, what I do is, I mean, any conference I go to, I'm up bright and early in the morning, and I always end up doing a small run. It's not huge. I'm not even. I'm so embarrassed that I will never admit to the kilometers even. But it's very little. But all I can say is I do a little bit every day. So every conference, every hotel I get up, even if I can't do it outside, I'm actually getting used to that treadmill kind of a concept now, which was not something that I would do before. I have been sort of, almost all over this country and even outside. So my favorite is definitely the streets in Bangkok and Singapore. That's where I really have enjoyed running. Those streets are made for running. It's very, very easy. You can be on the sidewalk for a long, long time, and just very easy to run there. Not so easy in India, I think, on the streets. But we have a biodiversity park very close, and I actually like the idea of running in through the wilderness and through the trees. That's what my favorite spot would be.
Great. So, sir, obviously working in orthopedics, rehabilitation is extremely important for your patients. How do you get across to them the importance of actually engaging with exercise? What kind of messages do you try and get across to them?
Okay. So, Darren, I think as you rightly said, my part is very, very small in terms of the surgical part. As you rightly know and have said, rehab is the main thing. Frankly, you can actually make or predict about who's going to do well, who's not going to do well based on what their motivation is for a rehab. The worst patient is the one who gets into some sort of a surgery, and at the end of it, that's it. I've done my bit. Somebody else is going to do that, and that's never really going to work out. So the first thing is picking the right patient and actually picking them and say, look, how motivated are you into getting into this one? Again, I think you and me both know that we are talking only of routine surgery. We're not talking about fractures and injuries and all. So for the routine surgery, pick your right patients up. If you think this guy's just going to get a surgery done, go lie down on the couch, you might as well give up on him. So pick your patients up right in the beginning. Tell them about the course that, look, this is not a one-day kind of thing. This was going to take a few weeks, months. You want to get the best of it. Work, your participation is as much as we, and you need to get professional help. Whether you get a physiotherapist, you get a trainer, you get a yoga guy, it's up to you. It's your comfort zone. But if you're not going to do rehab, don't even start with this one. And actually, once you actually show them, introduce them to a few people who've been to it, they're actually pretty much engaged with it right in the beginning. The ones who lose out will just drop it there and say, that's it, not for me. So I think my conversation is fairly big with them in terms of what I expect them to do.
And so again, while you're talking about this bit, how much of it from your side about, hey, fitness generally is a good thing anyways, does that get a lot of weightage as well, or how is it, sir? Other than the rehab?
Sure. So my clinic, Rajat, is almost full. I mean, actually full of people with just these niggling pains and aches and all. So my age group, everybody thinks I should be seeing the 60 plus, but actually my age group is like 20 to about, my peak age group is 20 to 50, which is so unusual. I never thought that would be my peak age group. And you can well understand. So all these guys basically need only one thing. They need to rev up their fitness. And, all of them are just sort of, sitting laggard, that either it's that procrastination, or I'm going to do it tomorrow, or it's a laziness, or it's an excuse like, I've got too much work to do kind of a stuff. And you can just understand all they need is a little bit of a kick in the butt and say, look, it's up to you. If you're seriously thinking I'm going to give you that magic potion, which is going to get better, you're never going to win this. You need to move yourself now and get better. Otherwise, you're going to be coming back to me every month. So that puts them off. I mean, coming back to me every month, I think that's their ultimate thing. That's it. I'm done. I'm never going to get into that.
That's great. So do your colleagues have the same sentiment? Do they sort of have the same attitude to sort of general fitness and well-being?
I think, it's a generational shift. I can see a lot of my senior colleagues are quite happy, giving them the, in India, we have a lot of concept of warm fermentation and, give a lot of, heating and or cold or some electrical kind of a thing. And that just is it never does anything at all. I mean, it just gives you that little soothing feeling. It's like a mom wrapping the child with a blanket or something. That's all it does. But I can't see that percolating all the way. But definitely the generation thing is working. And plus, I think a few of us who spend more time outside, we slightly seem more motivated to do that because the culture is very different. I mean, in UK, I mean, you have a lunch break in between the hospital and half the hospital is outside running kind of a stuff. Everybody's got shoes lying in the desk and everything. And it's just something which is built into their culture, not so much in our culture, but I'm sure, I mean, I can see the streets now filling up slightly, not as much as they should.
So it's interesting what you say about the mom cuddling the child. That's effective in some ways, right? At least that
It
works.
is.
But the current part, that you kind of referred to, I have no idea. It's been 20 years of fighting that battle, and in India, I mean, when you talk about rehab centers, that's all they do. They switch on a few buttons and expect magic to happen.
Absolutely. And it's almost as if people expect me to write that only. And when I tell them, look, you'll have to go and do a little bit of workout. And that's what really catches them. I said, seriously? I said, yeah, actually, that's what I want you to do. But you're quite right. I think you had much more experience than I have in that field.
So taking it further, what other myths and misconceptions that you have to deal with on a very regular basis that people just aren't aware of it or think it incorrectly?
So one thing that catches me out is how women in this country seem to lag so far behind in terms of the physical output. So my typical patient. Sorry, I'm really making it very my occupation based, but I'll try to be quick in this. So the women in this country are a big problem. All of them think they've done their homework. They've actually gone and picked up their child from school or whatever, dropped the child to school, and that's it, done. We've had studies in which you've given the pedometers and all and said, look, just give me an idea about the number of steps and how our houses are. They're about 2-bedroom houses kind of stuff. They've done somewhere like 2,000, 2,500 steps, and we're talking about ladies who are 30-year-old, 35-year-old. I mean, how's that ever going to work out for them? But they're in their mind, they're convinced because they've done the cooking and the cleaning and something, that's it. They've done for the exercise for the day, and telling them, look, and you need to get them outside the house. The biggest, they just sit inside the house. That's a very big problem for me. Closes the mind, closes the body. Pushing them out of the house has been one of the major things that I spend time on and said, look, you need to get on the street and do something. Otherwise, it's never going to work out. That's a very major. And the other thing is the elderly. Remember, there was this thing about, I'm so old, so I'm all done. And more you realize now is the time you should do more rather than do less. So I think they're actually getting keyed up to the idea, look, being elderly doesn't give you any relaxation for physical activity.
It's probably more of a reason, no? So, I mean, if someone's like, say, a 65 or a 70, it's more of a reason to get on with it.
That's it. So they need to push harder. They are the ones who need to push harder. I mean, I think I'm lagging behind in my fitness journey for the last 10 years. But, one thing that is really, I mean, I'm an asthmatic. And one thing that really, I discussed that with you in the past. One thing that's really worked up with me in my fitness is actually yoga. So, getting that yoga thing worked out where I started utilizing, especially running and all, what I realized is never using my abdominal muscles for getting the air out. And that has been a really big thing for I'm sure every runner knows about it, but Kapalbhati is what it's called, in which you sort of, push your abdomen more. And that's actually increased my running quite a bit. And I think the other thing is people go wrong when they start, have a small circuit. The circuit is a big problem. You need to have a circuitless training for me to, actually increase the distance. Otherwise, you're just looking at the circle and say, look, I've done one circle and I'm done kind of stuff. That limitless kind of a thing, that road that never ends, that's what really makes a big difference. So breathing has been a very, very big thing for me. It took a while for me to understand that, but I think I've got the hang of it now. Second thing is, I was, running in the park was not a good idea. You need to work streets or the open air.
So you talked about the motivation of an individual and how sort of a lack of motivation or, just being restricted to the house might not contribute to the individual conducting sort of exercise as they should. Is that sort of a societal problem as well? Is there enough infrastructure in place to support these people to exercise?
Yeah, Darren, that's a fairly big problem, although I keep on criticizing and belittling all these people, but, that's my way of motivating them. But you're absolutely right. I think, unfortunately, it's a cultural thing. So it's society which puts a lot of these impediments on them. Not to say that these are burdens which can't be broken. These are not bondages which can't be broken. But there's no doubt that the cultural thing is a very, very big thing. So, for you don't see, even today, I don't see women or girls running on the street. It's not, I mean, men I can see, but women is just not something that I see very often. So they need a different kind of an environment. And I think, having a lack of too many open spaces is a problem for them. I agree entirely, and you hit it on the head. But they need to break out of it. And definitely the gyms are working well now. We got a gym now pretty much in a city like Delhi, almost everywhere. So they are trying to reach these places and they're doing better. So the treadmill is a big winner, I can tell you. In my opinion, keeping a treadmill at home is not a bad idea at all. I used to think it's a cloth hanging thing, but now I think I can realize, especially realize that we're having shutdowns and all, and in the winters, I realize actually treadmill is not that bad a thing, and they're not that expensive, and there are enough people selling second-hand ones.
So, taking to the next level, as much as we're talking about the ladies and the society, but we ourselves as a fraternity are pretty pathetic, isn't it? What percentage of us are active? Very, very low. And
Very,
how do we
very.
change that?
Yeah, single digits almost, isn't it? I mean, if you ask me percentage-wise, single digits. But I think these. I mean, I'm really more out on the field kind of a guy, and that's why I feel the marathons are the ones which are really, there is a lot of enthusiasm now, and peer pressure. Peer pressure is wonderful. I mean, hopefully, this kind of a chat is fairly good. People realizing, even this guy can run is great. I mean, even if this guy tries kind of a stuff, that I'm so much like an ordinary kind of. I don't know, as I said, I mean, there are no six packs out here, there are no bulging muscles in here. So, I mean, it's simple things like oh, this guy can run kind of a stuff. The peer pressure is the wonderful thing. So in our hospital, we have few guys who are now running, and every year I see 2 more people add on to that group. So which is absolutely great. This is what I would want to sort of see more and more. So I think, each one influencing more is what will really work out.
So we're currently in this lockdown period. Would you have any advice for people to sort of stay active and exercise at home?
Okay, so this lockdown has been a big learner, I think, for a lot of people. I keep seeing these blogs, these messages, these WhatsApp chats and all. And, it's amazing how people are finding that inner strength within themselves. People would never have thought that, they would get down to their fitness kind of stuff. Now actually realizing that, the mind and the body game is such an important thing. So you're not going to keep a healthy, bright mind till you actually hit your physical levels better. So actually, everybody kept on thinking, oh, I'll come out looking much fatter and all. They're realizing there's enough things you can do at home. So, I mean, I think there are so many activities, but things like, yoga and all are such a big winner. And in this country, it's available, you can see it on YouTube, you can see it about 10 more channels and everything. So that's a really big winner. And the other thing which I think is something which brings out your mental strength is things like meditation and all. So I'm a big fan of meditation if you can get into it. So really sort of it gives you that motivation and focuses your mind on whatever you're doing. Even things like, focusing on, getting the best out of your body and all works well. So the meditation works, trying to do more yoga works, keeping something like a treadmill at home with a few dumbbells are actually much better, the TheraBands. So I think, I mean, I'm sure both of you know enough about this. The TRX system is such a great system. And in this country, it costs somewhere like about 7,000 rupees. You don't need to have fancy stuff to, hang it on the walls or something. You can actually put it in the door and do your stretches with that. It's such a great idea to actually, go. You don't need a huge setup for this. So, keeping some things like this at home, just packing a TheraBand into your suitcase when you go off to another hotel, such a great idea for me.
I mean, just summing everything up, or even if you we forgot to talk about something, in closing, what would you like to say?
So my suggestion to you is, it's never too late to start. And frankly, till you add up a combination of things, you need to have something like a cardiovascular routine, you need to have a strength training, you need to have some functional training. So all these things would combine to put together your thing. And definitely work on your lungs. Definitely works on your lungs. That is really going to be the winner for you in the long run, whether it is fighting a COVID or whether it's fighting an old age or something, but that's going to catch you out. The other thing is, focus on your, you need to take out the time. Nobody is too busy. Everybody's still got that 24 hours. It's how you utilize your 24 hours. You can cut your WhatsApp time, you can cut your coffee time, tea time, but there is enough time. So don't come around with the idea that, I'm too busy for this. Nobody is too busy. And this is what is going to increase your efficiency in whatever you do, whether it is your work, whether it's your conversation, whether it's your relationships. This is going to be the decider.
Fantastic. Well, thanks very much for joining us today, Dr. Bedi. It's been an absolute pleasure having you on.
Thank you so much. Thank you, Rajat. Thank you, Darren. Hope you guys have a wonderful series like this even in the future.
Thank you very much.
Thank you.
So thank you to everyone that's tuned in, and we'll bring you the next episode very soon.
Thank you, guys.